or it can be secondary to any other existing pathology inside the body. So it has to be carefully evaluated to find out what exactly is the cause. Now when you talk about most common age, there is no specific age that can, you can pinpoint saying this is the most common age wherein the cancers are prevalent. In young adults, bone tumors are very common, whereas in elderly age group, soft tissue sarcomas are more common, and also metastatic tumors wherein the tumor is coming from a cancer somewhere else in the body. So that is how it happens. Now when you see the symptoms, the most common symptoms are pain and swelling. So what sort of pain does the patient have? The patient will have a dull aching pain which is gradual in onset and it is progressively increasing. The pain never comes down, and despite taking medications, at one point of time the pain is uncontrollable and pain keeps on increasing. And when an unexplained swelling, when you have an injury or a trauma, it is common to have a swelling. అలా దెబ్బ తాకకుండా ఇంజరీ కాకుండా స్వెల్లింగ్ వచ్చింది అనుకోండి, ఆ స్వెల్లింగ్ అలానే పెరుగుతుంది అనుకోండి, పెరగడంతో నొప్పి కూడా పెరుగుతుంది అనుకోండి, దాట్ ఈస్ వెన్ యూ షుడ్ స్టార్ట్ డౌటింగ్ సేయింగ్ దెర్ ఈస్ సంథింగ్ రాంగ్ ఇన్సైడ్ ద బాడీ. ఎందుకంటే నార్మల్ సర్కమ్స్టాన్సెస్లలో అలా రాదు. అలా అయినప్పుడు దట్ ఈస్ వెన్ యూ హ్యావ్ టు గో మీట్ ఆర్థోపెడిక్ సర్జన్ ఆర్ ఆర్థోపెడిక్ ఆంకాలజిస్ట్. సో ఇట్ ఈస్ వెరీ ఇంపార్టెంట్ whom you go meet. So when you first meet someone, you will be first started off saying, after careful examination and evaluation, you will be asked for a x-ray. X-ray అయిన తర్వాత x-rayలో if there are any suspicion or if there are any doubts that there is something wrong in the bone, then the surgeon will ask for a MRI. ఒక్కసారి MRI అయితే MRI is confirmatory. MRIలో we can see what sort of a lesion it is, what is the extent of the lesion, how close it is to the neurovascular structures, blood vessels కి ఎంత క్లోజ్గా ఉంది, నర్వ్స్కి ఎంత క్లోజ్గా ఉన్నాయి, మళ్ళీ దాని తర్వాత మసిల్స్ ఎంత ఇన్వాల్వ్ అయి ఉన్నాయి, అవన్నీ మనకి ఎంఆర్ఐలో తెలుస్తాయి అన్నమాట. ఎంఆర్ఐ ఒకసారి అయిన తర్వాత ద నెక్స్ట్ స్టెప్ షుడ్ బి ఎ బయాప్సీ. కెన్ యూ ప్లీజ్ ప్లే ద థర్డ్ స్లైడ్? సో ఇఫ్ యూ కెన్ సీ ద మానిటర్, బయాప్సీలో 2 టైప్స్ ఉంటాయన్నమాట. వన్ ఈజ్ అన్ ఓపెన్ బయాప్సీ, అదర్ వన్ ఈజ్ అ నీడిల్ బయాప్సీ. వరల్డ్ ఓవర్ preferred technique of biopsy is a needle biopsy. Needle biopsy is smaller in size, just a centimeter in size, and the material obtained from a needle biopsy is sufficient for an experienced pathologist to examine the material and comment what exactly the pathology is. It is very essential that మనం ఏ మెటీరియల్ అయితే బయాప్సీలోకి వెళ్ళి తీస్తామో అదంతా ఒకటే పెథాలజిస్ట్కి పంపించాలి. బికాజ్ సార్కోమాస్ ఆర్ హెటరోజీనస్. Bone tumors are heterogeneous. So if we send 2 different samples to 2 different pathologists, there are high likelihood chances that we can get 2 different reports. So it is very essential that you send it to a single pathologist who is trained and comfortable in reporting bone sarcomas. Now can we go to the next slide? 4th slide. So after a biopsy is done, which is the needle biopsy, which is the most preferred technique, we'll know which type of bone tumor we are dealing with. Bone tumors are of 2 types. One is benign, other one is malignant. Benign tumors are slow growing and rarely metastasize inside the body, other than 1 or 2% of giant cell tumors which can spread to lungs. Other than that, they hardly spread in the body. But whereas malignant tumors are the dangerous types and which need very active management. Malignant tumors again will have 2 different types. One is the primary malignant tumors, other one are the metastatic ones. Primary malignant tumors, the most common ones are osteosarcoma, Ewing sarcoma and chondrosarcoma. Osteosarcoma are bone forming tumors, Ewing sarcoma are round cell tumors, and chondrosarcoma are chondroid or cartilaginous tumors. Now when you talk about metastatic tumors as in the tumor primarily is in some other organ of the body, like it can be thyroid gland, or it can be liver, it can be a lung, it can be a prostate, it can be breast or anywhere else. That is where the primary origin is. So once the tumor starts in that part of the body, there are high likelihood chances that it can spread to your bones, and that is where metastatic lesions are very necessary to be diagnosed. So now once you have a biopsy and you have a histology, now we will be talking about management of primary bone tumors only. Okay, so it is very essential to find out if the tumor that we are dealing with has spread anywhere else in the body. Okay, and then there's investigations to check if they've spread anywhere else in the body, like bone scan and CT thorax can be done for osteosarcoma, or FDG PET CT scan can be done for an Ewing sarcoma, and CT thorax alone is sufficient for a chondrosarcoma, or FDG PET scan also can be needed or used in few cases. Now when you talk about management aspect, can you play the 5th slide? When you talk about management aspect, management is specific for each disease. Management will be neoadjuvant therapy, surgery and adjuvant therapy. When you talk about disease like chondrosarcoma, there is no adjuvant therapy. Surgery is the mainstay for chondrosarcoma. But at the same time, when you talk about osteosarcoma and Ewing sarcoma, chemotherapy plays a very important role. Chemotherapy is initially given for first 2 or 3 months, following which surgery should be done. And when you talk about Ewing sarcoma tumors are radiosensitive. So radiation has a very good effect on Ewing sarcoma. So depending on the location and size and the characteristics of the lesion, radiation can be given in Ewing sarcoma cases. Radiation can be planned before surgery or after surgery. So your treating doctor, the orthopedic oncosurgeon, whoever is treating you, will discuss with you what exactly will be the plan, and then that is the way forward. Now surgery is the most crucial thing. A wrongly done surgery can spell doom for the patient. It is very essential who you choose to do your surgery. Surgery done first is the best surgery and the best chance for disease clearance. So it is very essential how you go forward with the surgery aspect and the planning. So planning is very important. So can you go to the 6th slide? Surgery is like it's actually a balance between oncological clearance and functional retaining. So you should never compromise on oncological clearance. The entire tumor with a layer of normal tissue has to be removed. Only then the tumor and the body will be disease free. If you are not able to excise the tumor completely, there is no point in operating. If you leave any part of the tumor inside, then whatever surgery has done, it becomes unsuccessful, and then disease coming back are very high, disease increasing and spreading across in the body are very high. So when you talk about surgery types, so surgery types are 2 types. One is biological, the other one is non-biological. So can we go to the 7th slide? So non-biological options are wherein you use a prosthesis, because now if you can see the screen is showing a femur bone, that is your thigh bone. Now let's assume there is a tumor in your thigh bone and it is occupying 15 centimeters of the bone above the knee joint. So when you remove 15 centimeters of the bone completely, there has to be an option to fill that gap, and that is where this tumor prosthesis or a mega prosthesis coming to picture. A rightly done surgery wherein we put in a prosthesis and the patient walks immediately on day 2 or 3 if everything goes fine. So that is how good the prostheses are these days. We have very good Indian prostheses as well, and then the options are unlimited, and then depending on the price range we can select the best. When you talk about pediatric age group, imagine the patient is 8 or 9 years old and the bone has to be removed, and then we put in this prosthesis. The opposite limb will keep growing, but the bone which has this prosthesis will be static, will not grow. That is where we have expandable prosthesis. Expandable prosthesis can be lengthened up to 9 centimeters in length along with the normal bone. So we have very good Indian and also imported prostheses. Imported prostheses are excellent variety and very costly, very expensive. So you have to discuss with your doctor which is the best for your child. So once you have non-biological, the other one is the biological reconstruction options. Biological reconstruction options are liquid nitrogen cryotherapy or extracorporeal radiotherapy using radiation. Here basically the tumor bone, switch to 8th slide please. The tumor bone, whichever is infected, is treated with liquid nitrogen or radiation. That kills all the cells within the bone, and once this bone is devoid of tumor, it is placed back in the body and fixed. So that will be biological, and it is like the normal bone is retained. Other than these 2 options, the other options are allograft. Allograft is someone else's bone which is sterilized and stored in sterile conditions, then that can be used. or autograft. Autograft as in, patient's same own bone can be taken from within the body from other parts and then used, like fibula can be used from the opposite leg or the same leg, or the ulna can be used in some instances. So this is where biological reconstruction options are very helpful, because they take longer, because there's no implant or there's no mega prosthesis inside, so that is the most preferred. But biological reconstruction cannot be done for all cases, so it depends on case to case basis, and then it's very essential to decide what is the best for your for the patient whenever it is planned. So now after surgery, if you talk about what are the prognosis. So correctly done surgery with the right team, with perfect management, including chemotherapy, surgery, and then post surgery again chemotherapy, the chances of disease coming back are very less, because when you catch it early, when the disease is not spread anywhere else in the body, that is the best treatment, and then whoever undergoes treatment that way, the chances of survival are very high and the disease coming back are very less. But nevertheless, disease chances of coming back are very high till 10 years. So you have to be under regular follow-up with your orthopedic oncology surgeon. So the chances of disease coming back are the highest in the first 2 years, then gradually decrease in the between 2 to 5, and then from 5 to 10 again the chances are very less. After 10 years, the chances of disease coming back, the tumor coming back in his body is almost negligible compared to anybody else who never had a tumor. So that is how the follow-up is very important. So when you go for a follow-up, you will be asked for radiographs of that particular body, of that particular part of the body where the patient was operated, or also imaging of the lung. Lung imaging can be in the form of a chest X-ray or a CT thorax based on the guidelines followed. So now it is like a team management, and a team management can only succeed in sarcoma management, sarcoma treatment. Now why are we saying KIMS? So why do we suggest KIMS, or why do we say we are the best? We have an experienced oncology setup here, wherein we have medical oncologists, radiation oncologists, and then we have a pathologist who is trained and very much experienced in diagnosing sarcomas, and also we have a radiology department and also a trained orthopedic oncosurgeon, which all together come together, give you the best outcomes and best treatment options. So, and then we have large number of branches all across Andhra and Telangana, and wherever you go, wherever you approach, I'm sure we'll all get in touch, and then we can find the best way forward. Thank you. I would like to take some questions now.
Are all bone tumors cancerous?
So like I already told, there are different types of bone tumors. One are the benign and malignant. So a biopsy is the only definite way which tells you which is what, if it's benign or malignant. So malignant type of tumors are very dangerous ones, and then they need to be acted upon fast, and then which need multimodality treatment like chemotherapy and radiation apart from surgery. Next.
అసలు మాకు బోన్ క్యాన్సర్ ఉంది అని మాకు ఎలా తెలుస్తుంది?
So there are 3 different signs. One is uncontrollable pain and swelling, which are not associated with any symptoms or signs. So like when you get injured, when you fall down, పడ్డారంటే నొప్పి వస్తుంది, స్వెల్లింగ్ వస్తుంది, వాపు వస్తుంది. పడిన తర్వాత అవి రావడం సహజం. పడకుండానే ఇవన్నీ స్టార్ట్ అయ్యాయి అనుకోండి, అప్పుడు యూ హ్యావ్ టు స్టార్ట్ డౌటింగ్ దెర్ ఇస్ సంథింగ్ రాంగ్ ఇన్సైడ్ యువర్ బాడీ, ఇన్సైడ్ దట్ పర్టిక్యులర్ బోన్, అండ్ దెన్ మీరు వెళ్ళి డాక్టర్ని కన్సల్ట్ చేయాలి.
సో వాట్ ఆర్ ద మేజర్ సిమ్టమ్స్ ఆఫ్ బోన్ క్యాన్సర్?
The major symptoms of bone cancer are pain and swelling, gradually increasing, and then there's massive swellings, like if you can go back to the first slide, there's massive swelling. You can see it on the screen. That is how the swelling can increase. You can see how poorly nourished the boy is, but the limb is like massive, huge. That was neglected. When acted upon early, the limb could have been saved. Now because it is neglected, it is very less likely that the limb will be saved. If treated early and operated early, 90% of the times limb can be saved. 90% of the chances limb can be saved and the patient can walk with his own limb. Next.
How does this cancer spread to bones?
So it initially originates from the bone, but it spreads using the blood routes, the blood vessels, lymphatics. That's how the cells spread, and then most common site is lung or other bones, or it can also go to liver in some cases. Next.
What are the chances of cancer coming back with these treatment plans?
So like I said, the treating team, who you choose, who you get treated with, who operates, who gives you chemo, that is very essential. If everything done right and the team is perfect, then the chances of disease coming back are very less, and so that's how it is. So you better choose your treating doctor wisely.
Okay, some patients are asking, like, my brother got pain in his thigh bone occasionally. How should we proceed further?
So if it's only occasional type of pain, that means it's not present throughout. So if it's not present throughout, it may not be something related to a cancer, because pain in cancer keeps increasing and never comes down. If the pain is increasing and decreasing, decreasing, that means there's some waxing and waning going on. If that is the issue going on, that means there's some other pathology like an infection or some other inflammatory condition going on, and the chances of cancer are less likely.
My father has prostate cancer. How to manage bone tumors?
So when you have a prostate cancer, it's very essential to get a PET scan done or a bone scan done to check which are the bones which are affected. In prostate, first the surgery is done, and once the surgery is done, the bone tumors whichever are there respond very well. So depending on which bone is initially affected, you have to protect that bone, and if it's a weight bearing bone, you may even have to operate. If it's not a weight bearing bone, you can wait for the primary treatment of the prostate to be done, and then you can think about what to do next about the bone tumors. But you have to be very active in finding out which are the bones which are affected, and then safeguard them and protect them till prostate tumor is addressed.
When should you decide to operate metastatic tumors?
So metastatic tumors, like I just told you, similar to the prostate issue, you have to first protect it, treat the primary first, whichever is a primary, chemotherapy or surgery or whatever is needed for the primary, like the thyroid or lung or liver or whatever. Once the primary is addressed, then you have to check for the metastatic tumors. If it is in the weight bearing bones, upfront surgery may be advised, because it can lead to a fracture. If it is already fractured, then again surgery is advised upfront. Next.
What types of cancers arise in the bones?
So like I said, again, benign and malignant types, and then biopsy is the best way to check what are these. X-ray and MRI are suggestive. You can tell if it's a benign or malignant lesion on an X-ray, but biopsy, a needle biopsy done right, is very essential to check what type of a tumor we are dealing with.
Doctor told me there is infection in my bone, but how to check if it's not a tumor?
Infection, like I said, one main symptom is pain keeps coming and going. There is waxing and waning, and then there will be other issues like you may have fever or evening night sweats and all that things. So that is where you have to be very careful if it's infection or tumor. And imaging in the form of an X-ray and MRI can also suggest what exactly we are dealing with. But when you are in doubt, and when you are not sure what exactly it is, if it is infection or if it is tumor, it is always better to get a biopsy done first after adequate imaging. X-ray, MRI still in doubt, and it's not confirmatory what it is, you have to do a biopsy. Biopsy chesi, biopsy ni histopathology ki pampichi, we have to check what exactly we are dealing with before you do a definitive surgery. Imagine if we think it is infection, we go ahead, do the surgery, and it turns out to be Ewing sarcoma, then the treatment options are very limited in such a limb. Patient may even end up in amputation. So that's why it's very essential that you check what you are dealing with and what you are treating.
Precautions to be taken when we are diagnosed with bone cancer.
So this is a very good question actually. So when you are diagnosed with a cancer, imagine you are diagnosed with an osteosarcoma. So once you know you have an osteosarcoma, you are referred to the medical oncologist for chemotherapy. So you are with the medical oncologist for 2 or 3 months. So for 2 or 3 months you may not see your surgeon who will do the final surgery. So during this time your bone is already weak. So because the bone is already weak, you should not put weight on that particular bone. You should always use crutches if it's lower limb, or use support in the form of an arm pouch or something if it's upper limb. So if you put weight and then if the bone becomes weaker, chances of bone breaking, that is called a pathological fracture, the bone breaking and then are very high. Once the bone breaks, the chances of saving the limb and operating successfully are very less. So that is what very crucial, that you have to protect your bone. Next.
బోన్ క్యాన్సర్ ఉండటం వల్ల బోన్ ని రిమూవ్ చేసే అవకాశం ఏమైనా ఉంటుందా?
So yes, depending on what kind of lesion you are dealing with, benign or malignant. Benign ankondi, the same bone can be retained, and then there's something called curettage or radio frequency ablation and all that, and then we can retain that bone. But if we are dealing with the malignant lesions, then bone has to be removed. Ent bone tiyali, en tiyali anedi, it all depends on what sort of a bone, what sort of a lesion we are dealing with, and then where exactly the lesion is. So depending on what exactly the pathology is, malignant or benign, so bone has to be removed. Right. Okay. Okay, I would like to thank everyone who has seen it, and then I hope my talk helps. And then if you have any other queries, feel free to post under the video. We'll get back to you. I'm there here at KIMS Hospital, Secunderabad from Monday to Friday from 9 to 4. You can take an appointment, come down and then consult anytime for any queries. We are